In this video, we're going to talk about Boil Ease Ointment. This medication is used on the skin to stop itching and pain from certain skin conditions such as scrapes, minor burns, and insect bites. It is also used to treat minor discomfort and itching caused by hemorrhoids, anal fissures, and itching around the vagina/rectum. The active ingredient, benzocaine, is a local anesthetic that works by causing temporary numbness/loss of feeling in the skin. When using this ointment, it's important to apply a thin layer to the affected area up to 4 times a day. It's best to use it as soon as the itching or pain starts. Remember to wash your hands before and after applying the ointment, and avoid getting it in your eyes, nose, or mouth. Always follow the directions on the label, and if you have any concerns, consult your healthcare provider. Before using Boil Ease Ointment, make sure to read all the directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. Clean and dry the affected area as directed before applying a thin layer of the medication. If you are using the spray, shake the can well before using. Hold the can 6 to 12 inches from the affected area and spray until wet. Do not spray near your eyes, nose, or mouth. Do not use on large areas of the body. Cover the area with waterproof bandages or plastic, or apply heat unless directed to do so by your doctor. After use, wash your hands unless you are treating an area on the hands. Avoid getting the product in your eyes, nose, or mouth. If the medication gets in these areas, rinse right away with plenty of water. The dosage is based on your medical condition and response to treatment. Do not use more of this product, use it more often, or use it longer than directed. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. Some temporary redness, stinging, or irritation at the application site may occur, but these effects usually do not last long. If you experience any of these effects for an extended period of time, it is important to consult your doctor or pharmacist. If your doctor has advised you to use this medication, it is because they believe that the benefits of using it outweigh the potential risks of side effects. Most people who use this medication do not experience any serious side effects. In rare cases, this medication may cause a very serious blood disorder called methemoglobinemia, which can be potentially fatal. If you have difficulty breathing, certain blood diseases, or smoke, you may be at a higher risk for this condition. Symptoms may occur shortly after using the medication, and it is important to seek medical help immediately if you notice any signs of methemoglobinemia, such as pale or bluish skin, unusual tiredness, or shortness of breath. While very rare, a serious allergic reaction to this medication is possible. If you notice any symptoms of a severe allergic reaction, such as rash, swelling, or trouble breathing, it is crucial to seek medical help right away. It's important to note that this is not a complete list of all possible side effects, and if you experience any other effects not mentioned here, it's best to consult your doctor or pharmacist for guidance. Before using Boil Ease Ointment, make sure to tell your doctor or pharmacist if you are allergic to benzocaine or other cane anesthetics, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have broken skin/infection in the affected area, heart disease, certain blood disorders, or breathing problems. Before having surgery, let your doctor or dentist know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, only use this medication if it is clearly needed. It's important to discuss the risks and benefits with your doctor. It's also uncertain if this medication passes into breast milk, so nursing mothers should avoid using it on or near the nipple to prevent a nursing infant from swallowing it. Be sure to consult your doctor before breastfeeding. When using Boil Ease Ointment, it is important to be aware of potential drug interactions that may affect how the medication works or increase the risk of serious side effects. It is essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It is crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication regimen. It's important to note that Boil Ease ointment should not be swallowed as it can be harmful. In case of an overdose with serious symptoms such as passing out or trouble breathing, it's crucial to seek immediate medical attention by calling 911 or contacting a poison control center. This can include symptoms such as irregular heartbeat and seizures. As for the usage of Boil Ease ointment, it is typically applied to the affected area 1 to 3 times daily as needed. It is best to apply a thin layer of the ointment and gently massage it into the skin. It is important to wash your hands before and after applying the ointment. The optimal time to apply the ointment is when the affected area is clean and dry. Be sure to follow the directions on the product label and consult with a healthcare professional if you have any questions or concerns. Make sure to keep all your regular medical and lab appointments. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. If you are using Boil Ease ointment on a regular schedule and forget to apply it, use it as soon as you remember. If it is close to the time for your next dose, skip the missed dose and continue with your regular schedule. Do not apply double the amount to make up for the missed dose. Remember to store your Boil Ease ointment at room temperature and avoid freezing it. Keep it out of reach of children and pets. When you no longer need it or it has expired, make sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.